Modern medicine has come a long way over the last several decades, eradicating many terrible diseases and making others very manageable. However, there remain some rather disturbing illnesses out there, both rare and challenging for researchers to cure. From terrible diseases that disfigure the afflicted to ones that cause overwhelming physical pain. These are definitely some scary diseases you will want to avoid. So press that subscribe button and put down that sandwich because we're pretty sure you're not going to want to eat while taking this one in. Neurofibromatosis. This strange-sounding disease sounds totally made up. We wish it was. Neurofibromatosis is a rare condition that sees those afflicted develop generally non-cancerous tumors on their nerve tissue. That means wherever you have nerves, a tumor can develop. As you can imagine, since humans are covered in nerves, tumors can pretty much appear anywhere, including the brain and the spine. In extreme cases, the person can even develop tumors all over their skin with dramatic results. Noma. Known in the medical community as cancrum oris, noma is a horribly disfiguring disease. In short, it's a gangrene that attacks and destroys the mouth. If left untreated, it can even spread to other parts of the body. Researchers believe this is caused by one specific bacteria which grows rapidly in undernourished children and those with weakened immune systems. The good news is this can be treated with antibiotics and better nutrition. Unfortunately, if left untreated too long, the damage can be rather extensive. Complex regional pain syndrome. If you've broken a leg or arm, then you know it can really hurt. Now imagine healing from that injury only to suffer a comparable or worse pain for months or even years on end. Researchers call it complex regional pain syndrome, and it happens when an injury in the body triggers a miscommunication between the nerves in your limbs with your brain and spine that make up your central nervous system. In short, your brain keeps getting pain signals from certain parts of your body even though there is nothing wrong. While there are treatments, there is no cure-all for this strange and rather scary condition. Brainerd diarrhea. Okay, so you're probably thinking that diarrhea isn't really scary. Uncomfortable? Sure, but not scary. Well, we would like to introduce you to Brainerd diarrhea. Named after the Minnesota city where the first outbreak was ever reported, those who got this very particular type of diarrhea can't be away from a toilet for months. Those afflicted suffer explosive diarrhea up to 20 times a day, and it lasts for months. Worse yet, there's no known treatment because researchers have no clue what specifically causes it. They do know, however, that it's linked to raw milk and untreated water, so stay away from those. Ondine's curse. You're doing it right now, without even thinking about it. We're of course talking about breathing. For the vast majority of people, breathing is just something our bodies do naturally. Then there are the people afflicted with what is known as Ondine's curse. Also known as central hypoventilation syndrome, this condition requires the afflicted to consciously focus on breathing. Bedtime is even more dangerous, as without equipment to help them breathe, people with this disease would simply stop breathing and never wake up. Madura foot. This is definitely another good reason to always wear sandals when you're on vacation. Also known as mycetoma, Madura foot is a disease found mostly in tropical regions. Caused by either a fungus or bacteria, those who contract this usually do so through their feet, which is where it is most commonly seen. Relatively painless, if allowed to develop, Madura foot can cause considerable damage, as you can likely tell from the pictures. If left untreated, it can badly disfigure a person's limbs and lead to other infections and even death. Marburg virus. You've likely all heard of Ebola, but what about the Marburg virus? Related to the Ebola virus, the Marburg virus is definitely nasty enough to star in its own Hollywood thriller. Named after Marburg, Germany, where the first outbreak occurred, this virus was originally spread by infected monkeys. Trust us, you do not want to get this. How do you know if you have it? Well, after a few days of nasty flu-like symptoms, you can be pretty sure you're in trouble when you start bleeding out of every orifice. It's that bad. Fibrodysplasia. Considered one of the rarest conditions in medicine, fibrodysplasia is truly a terrifying condition. In the 800 cases so far identified, those who suffer from this can do nothing as their muscles, tendons, and ligaments turn into bone. This condition sees people slowly lose mobility as all of their connective tissue hardens over time. Especially cruel is the fact that there is absolutely no known cure, and attempts to correct fibrodysplasia with surgery actually make the patient's condition worsen. Clarkson's disease. Imagine if you started to swell uncontrollably for seemingly no reason at all. This is a rare disease that, in a nutshell, sees plasma leak from the blood vessels and fill the body cavity and surrounding tissues. The result is that people swell up as fluid fills their body. Even more dangerously, this can cause blood pressure to drop and internal organs to fail. Treatment involves the use of steroids to reduce fluid leaking from the blood vessels and mixtures of other drugs to lower the chances of an attack. Wool sorter's disease. Anthrax is actually a biological weapon developed by many militaries around the world. Sheep are farm animals that give us wool. What do they have in common? It turns out that sheep are also walking weapons of mass destruction. You see, the sheep and their wool are actually a source of bacteria that produces anthrax spores. These spores can get inside you either through your skin or by inhaling. Once inside, the damage really starts and death can come in as little as 1 to 2 days. The good news is, the spores require a dead and decaying body to form. The bad news, those spores can live for decades, like microscopic zombies. So now that we've thoroughly ruined your lunch, you might as well stick around. Why not brush up on some more diseases and freaky disorders? We've got a bunch of related videos on offer here at The Richest. Remember to subscribe, and we'll see you next time. Bye-bye.